spring 2023 semester. Please feel free to enjoy some refreshments anytime throughout the presentations. Thank you very much for being here today as we welcome Dr. Shannon Deets. Due to unforeseen circumstances, Professor Jesse Amar is unable to be here today. Dr. Deets has served in the psychology department since 2015, and since that time has distinguished herself by teaching many courses in the psychology department, serving as advisor to Alpha Chi, faculty council representative, and service on many other committees. She has many research interests that have grown out of her practice as a licensed professional counselor. Today she will discuss The Therapist is the Technique, Understanding the Scholar, Practitioner, Clinical Model of Training, which was a sabbatical project that included training in clinical hours, scholarship in the mental health treatment of trauma, and the creation of the PA 517 Behavioral Medicine course. She will also describe the scholar practitioner model of training and why she believes a third role distinction labeled clinician is important. She will share with us how her own interpersonal growth as therapist was integral to completing all of her sabbatical tasks. Most importantly, she will propose that the interpersonal growth of the therapist is the curative factor in therapy. I am proud to present my colleague, Dr. Deets.
So I was asked by my department to explain their absence. I told them not to worry about it, that it wasn't a big deal. I'm actually more comfortable with a smaller group, but they felt that that was bad. So they all have other things they're doing. It's not a big deal. All right, so I'm going to talk about The Therapist is the Technique. And so really this came out of my sabbatical work. There were 3 large areas or tasks that I wanted to complete during my sabbatical. One of them was I wanted to get mastery certification in the treatment of trauma. And so I did a lot of work preparing for that, and I'll let you know about that in a minute. I also had to prepare the PA 517 Behavioral Medicine course for the physician's assistants students, and I'll talk about that. And then the third role is I worked as a consultant with the master's degree in clinical mental health counseling in that program. So for my trauma mastery certification, there were a number of trainings that I needed to go to. These are a listing of the different trainings. These are all done by a variety of professionals in the field. And you can see that they cover kind of a large area. Everything from the polyvagal theory to race-based traumatic stress, working with somatic experiencing in the body. And so there's just a big variety of courses that I completed. What I learned, so with these courses, they all have learning objectives, and I've given you just a sampling of some of them, what they might look like, right? So determine how the autonomic nervous system is related to social and defensive behaviors, appraise the clinical conditions necessary to promote feelings of safety in the client, and then theorize why deficits in the social engagement system are core features of several psychiatric disorders. So these are just some of the objectives. Each one of those courses that I took had the whole listing of objectives. What I did then is when I looked at this series in completion and said, what's the main idea of all of these courses together, I kind of came up with 3. One, it was all about the therapist learning how to create a safe and supportive environment for clients. It was about learning about the various mechanisms of trauma and then how I could utilize various techniques to help people with those symptoms of trauma. And then it also really demonstrated that the relational qualities of the therapist is actually very important when you're working with traumatized clients. If the therapist can't create an environment of safety and support, that person never gets a chance to actually start to work on that trauma because they're never in a safe place. All right, and so really with this, it's the idea of the embodiment of the therapist is the key. If we look at some research, this has been going on for quite some time that we've really looked at what is the role of the therapist in therapy. And so some of these authors have basically said that therapist is pinnacle. So namely the personal characteristics of the therapist are some of those non-specific factors that we see that are things that contribute to therapeutic wellness. And so the characteristic of the therapist constantly pops up there. We have other theorists that say that, I love this one by Egan, that even though helpers don't cure their clients, the relationship itself can be therapeutic. And the reason for saying that we don't cure anyone is because it's meant to be a process that you engage in together. It's not meant to be something that I do to you, right? And so we're not looking for cure, we're actually looking for healing. And so in that context, that relationship is really important for healing. And then there's the last one here, there's a strong argument that it's the therapist and not the therapy model per se that is more influential in the outcome of the therapeutic process. And so I teach lots of courses. One of the ones that I teach is counseling methods, and we talk about all the different styles of counseling. But really, when we come down to it, it's how that therapist embodies that methodology, how that therapist embodies certain values, and that presentation to the client is what's actually meant more effective, right? We could say, well, cognitive behavioral therapy versus interpersonal process, but what it's really going to come down to, what we see, is it's really that character of the therapist that makes a difference. And then, with our behavioral medicine course, 517, the stated goal was basically I just needed to create this behavioral medicine course. The requirements, however, I needed to make sure that I was incorporating all of the appropriate learning objectives for PA students. There's a whole accrediting body that you have to go through and make sure that you're giving them everything that they need. But my personal goal in part of this was I wanted the physician's assistant students basically to be good clinicians. I didn't want to see that they were biased in the way that they deal with people with mental illness. And so I really thought it was very important that I had to work with them on having some of those counselor skills for them to actually be really good at dealing with the mental illness of their clients. And so there were certainly some course outcomes that we wanted to see, right? One of them was we wanted to be able to talk about the practice of medicine, specifically looking at psychiatric or behavioral services, how to conduct an interview, how to incorporate those different aspects of medicine into clinical decision making, right? So what do you do for depression versus anxiety that's different? Active listening skills, so you'll see that that was really huge. That's really a large part of what being a counselor is actually learning to listen. And then the biopsychosocial model of health. So traditionally the medical model looks at things just like the physical contributions to disease. When you're looking at a biopsychosocial model, that includes social aspects, cultural aspects, as well as psychological factors. All right, so those were like the basic ideas. And then I set up the different objectives. These are the ways that I was going to meet those learning outcomes, right? So I wanted students to demonstrate competency in understanding diversity. I wanted them to be able to have some problem-solving skills, some interpersonal communication skills, and then after that we have the demonstrating competency. So notice that a lot of those were interpersonal skills first, so we got to the actual content competency of it. So if you want to look at this from a topical perspective, on the right-hand side from your perspective, all of those are listed the various kinds of disorders, the different categories. But what you'll see is that on the left side, these are all the other topics that I felt I needed to teach the physician's assistant students before we even got into the disorders. And so you'll see about half of the course is not actually talking about the symptoms of specific disorders. About half of the course is actually talking about those counseling skills, those theories, aspects of that. So what I learned about this is basically, if I'm going to teach about mental illness treatment, I have to spend a half of the course actually working on empathy, active listening, interviewing skills, rapport building, and personal and interpersonal growth of PA students. There is a growth process to being able to approach your clients in a non-judgmental way, with congruency, with empathy, right? And so that's that interpersonal growth that we see a lot of times with our counselors, and I wanted to make sure that we included that in the PA class as well. And so therefore, the therapist, or in this case, PA student, is really the technique. If you don't have these interpersonal skills, when you're talking to your clients, you're gonna miss things. They're not going to give you all the information, right? So being able to recognize when someone says to you, I feel like a different person, okay, we have to use our interpersonal skills, our relationship skills to understand what that means. Is this someone who has multiple personality disorder? They really are different people. Is this someone who feels like they have a bipolar disorder? When they say, I feel like different people, and one day I'm mad and the next day I'm crying, right? So we use the relationship to understand that. If we simply ask the questions, we're not gonna get that same level of interaction and we're gonna miss things. So actually in behavioral medicine, the better the relationship is between the physician and the client, the more accurate the diagnosis is. We also see a reduction in the number of unneeded tests and procedures that are performed. All right, and so just to give you a couple of ideas, and these are just some of the slides that I developed for that for that physician's assistant course. Again, this is emphasizing that traditionally biology looks at these areas for disease, and then when we go into psychology, we're seeing that this has to do with the personal experiences and the behaviors. And then those can also be included somewhat with the way that we interact with our families, with other people, but then that starts to get into the social realm as well, right? So our interactions with family, our interactions with society. This is just another way of looking at this, and I like this one from a psychology perspective because it actually divides it into intra and interpersonal aspects, right? So just a little bit more detail. And then up there in that final category is transplanetary. Transplanetary is really this idea of all of us excelling and actualizing almost beyond what it means to be human. And so I wanted to point that out, that that's not something that we technically would look at in medicine, right? But there is a process of what it means to be human that drives us in everything we do. And so we do need to consider those qualifications and those categories to be accurate. All right, and then again, from a medical perspective, curing versus healing, they say clinicians cure diseases with medicines and surgeries and biotechnology. So we're literally taking that little bacteria, right? And we're dealing with it, and we're curing that, right? The bacteria with the medication. However, the way that you heal is through those therapeutic relationships. So let's say that you have a really bad infection, and so I'm curing your infection with giving you an antibiotic. But I also need to know how that infection was impacting you. Did you miss 2 weeks of school? Did you miss sporting events, right? Things like that. Because we need to also deal with all the emotional aspects of that as well. We know, again, if we treat the whole person, that those systems repair much more quickly. Even with surgery, we've had histories where people have had 2 conditions. One condition, the surgeon is saying things like, this is really good, that we got this right away, this is great, the person's really gonna function well. And then in the other condition, they had surgeons say things like, ooh, this is a little worse than we thought, oh, we should have gotten to this sooner. And then they compared those patients. What they found is with the positive statements, those patients healed much more quickly and were a third less likely to actually have secondary infection from the surgeries. So there's huge differences in our physical aspects that come from our mental well-being. Medical interviewing then, they saw, is a method by which to cure and to heal, right? Because that medical interview is supposed to be building that relationship to get that information. And then even go so far as to say that the medical interview is what makes the clinician, right? You can memorize a bunch of facts, but be able to connect with another person and use that information appropriately, that's really what makes you the clinician. And so then this is just a graphic of all of the things that they're supposed to think about while they're doing these clinical interviews. But what I love is that at the very beginning of this are fundamental skills. themselves. We're going to be attentive and empathetic, right? We're going to do this non-verbally and verbally. These are all relationship skills. And then the last thing that I kind of included here for this class was this one that physicians are often seen as people that are in positions of privilege. And so it's really important that we understand when you're approaching a client, where is that privilege showing up? How is it blocking you from having that connection? So one of the activities that I have them do is this crossing the line activity. You've probably heard it before. It basically is a listing of different characteristics of different groups of people, and you have people either cross the line if they've had that characteristic or experience with it or not. But this leads to discussion, right? It leads to the idea of, well, yeah, what was your life really like if you didn't have a library close to your home growing up, right? Or if there were only bars next door, right? How is that different? And so that gives them some experiences. And then the other part of this, we are privileged in that clients give us the most intimate details of their life. Who else are you gonna go to that you're gonna tell these things to? And so I think we always have to hold that as a place of honor, that we want to be the type of person that's worthy of individuals coming to us and giving us their secrets. And then sometimes it even actually society expects clinicians to be the clinician and subvert their own interest, right? So like if you're a doctor and you're at Sheets, you're a doctor at Sheets, right? You're not just the regular random person. I used to work in a clinical office that has psychiatrists who like to walk down to Sheets to get his lunch each day, and I'd always ask him, well, how many sessions did you have at Sheets today? Because that was just kind of what it was, right? Like when the patients would see him, they'd be like, oh yeah, by the way. So that's what I learned about that. Then my third task was working as a consultant with a master's in clinical mental health. This was a little stranger because this kind of went before, during, and even after my sabbatical. Sometimes things are not necessarily linear, right? But so part of what I was doing with this is I led the search for the program director. So we have Ken McCurdy, who is now the program director, and we're very excited about that. I developed the preliminary courses. There are 20 of them. Now obviously once we get all the full faculty in, they can change these and mold these in ways that are more appropriate for what they're envisioning. But I basically set up the whole mental health master's program according to a social justice philosophy. And so then I incorporated and made these courses. And then the orientation to Thiel aspect. So part of that was me kind of helping Ken get more familiar with how Thiel does things. But that's also part of my responsibility at this point is to orient those new students that are doing the bachelor's, master's 5-year program into being present at Thiel, into being counselors, into being into this program. And so that is what I learned here, that this was an ongoing process. It wasn't going to be something that's like, oh, sabbatical, boom, boom, I'm done, and that's great. No, this is ongoing. The other thing is that this whole task is basically just Shannon, right? Like, this is me. This is how I do things. And it would be impossible for me to have been able to separate out my personality from this development. And so again, what is it that we're finding? Well, the therapist is the technique, right? This is the Shannon show, as I said. All right, so then, just to prove to you, I hope I've convinced you at this point that the therapist is the most important aspect. But there's also some research that tells us this. And so the American Psychological Association got together a work group and they discussed what are those actual factors in therapy that do seem to be effective in healing the client. And so they were able to divide these into different categories. The top 3 categories are things like demonstratively effective, so these things we know for sure. And then the next category is they're probably effective, we could see how this could be, and then the last one is, well, we think they work, but we don't have any evidence, right? So the first category, that these are demonstratively effective, the alliance, right? Which is just another way of saying the therapeutic relationship. So how the therapist builds that relationship. Collaboration, clearly a relationship kind of aspect, goal consensus, cohesion, empathy, collecting and delivering client feedback. The actual act of getting feedback from your clients or giving them feedback is a relationship building skill, right? The way that you give them feedback can enhance the relationship or can damage it. So that's something we need to know. And then positive regard or affirmation. All right, probably effective. Congruence and genuineness. The real relationship. So I love this. The real relationship is when you get to the point with your client where they no longer see you as the professional therapist, right? And they see you as like another human being. And you have where you're meeting them in this place of your two human beings coming together and you're meeting on that level of humanity, not necessarily these other ideas. The emotional expression, cultivating positive experiences, treatment credibility, managing countertransference. Countertransference is all about the relationship and who you are as a therapist, and then repairing alliance ruptures. And then promising but not sufficiently researched, self-disclosure and immediacy. I would love to see more research on these because I think that self-disclosure could be a really powerful but also very dangerous technique that we can use with our clients. All right, and so basically what I did then is I said, well, what's the list? What do therapists actually have to do and be in order to be good therapists, right? And so the interpersonal skills that they need, I kind of highlighted all of these that I think has to do with the growth of the individual counselor versus things like number 12, reliance on the best research evidence. That would require you to be able to have some scholarly work, know how to read research, know how to analyze research, things like that. But all of these others you'll see are all interpersonal skills. And so then when I combine these, what I find is these are all of the sets of skills that counselors need. Most of them are interpersonal skills, and then we have some other skills. And even the other skills can be somewhat personally determined. Competency. Maybe you're a really competent therapist, but you don't do a good job of expressing that to your client, right? So that's actually an interpersonal skill that you would need to work on to be more effective. Continual training. I love school. I love to learn. That's probably a personality aspect of me, right? And so we hope that our counselors also want to do that because I will tell you, you cannot be a counselor if you're not willing to continue to grow and learn and basically live life as a human being. All right, and so then we do have this lovely thing. Maslow came up with this idea of self-actualizing characteristics. And so he listed these variety of characteristics that he felt were indicative that somebody has self-actualized. I'll come back to them in just a minute. I want to show you this. So I do want to say that I think counselors are in the process of becoming actualized. I'm not saying that counselors are fully actualized people, right? I'm not trying to say that counselors are Gandhi, right? But we're on that path. And so you'll see the traditional model over on the right-hand side there that has Maslow's different levels of needs and kind of some descriptions of what they are. And then over here on the left-hand side, you'll actually see that self-actualization is not the top category, but then there's this idea of transcendence. I tend to think about things more so in this way. Also, if you are doing any transpersonal psychology work, there's a whole other inverted pyramid that goes up from that transcendence point, and that's all about the stages you go through as you're transcending beyond human beings or human nature. So this is, I believe that therapists are in a process of self-actualization, not necessarily that we're always fully actualized. So some of those characteristics then, efficient perceptions of reality. Really, are you able to judge a situation correctly and honestly? That honestly part is the hard part, right? How do you describe to your clients what's really going on to them in a way that they can see and that's accurate? Comfortable acceptance of self, others, and nature. This is completely what counselors do. We basically sit around and we listen and we accept you. And that is what is curative, come to find out, right? Reliance on our own experiences and judgment, Spontaneous and natural, again, that element of genuineness in therapy. I am not like any other therapist, and I shouldn't be, because then I would be faking it, trying to be somebody rather than being me and bringing the therapy information to my clients. So you'll see some of these other ones listed here. Autonomy. I love this one, continued freshness of appreciation. So this is really the idea of experiencing things as if you experience them for the very first time. And this is a concept that's also in mindfulness. This is called new beginnings. So this idea that each time you approach it, it's a new experience. And I think that's such a valuable quality to have as a therapist, because you might have the 300th person who's coming to you with a domestic violence experience, but they're different than all 299 of those other folks that came to you. So that freshness each time. Comfort with solitude. I love that one too. Not a hostile sense of humor. Humor is amazing when you can use it in therapy, but you gotta be careful because you don't want to insult people, right? Socially compassionate, possessing humanity. Few friends. I don't know that this is necessarily an accurate representation. I think rather than say few friends, it should say deep and rewarding relationships, right? It's not surface level relationships. So there might be fewer of them, but it's not necessarily that you only have 2 friends. You might have a bunch of friends, you just happen to have really close relationships with them. I am not even, I'm gonna try it. This is a German word. Gemeinschaftsgefühl. Yeah, that's as close as I can get. This is social interest. Really, so Maslow says that for social interest, this is a quality where you have to be interested in your fellow human beings, right? This is